welcome back and thank you for staying with the broadcast. The St. Lucia Medical and Dental Association has announced that following the rollout of the vaccines in St. Lucia, every physician will be taking a jab. President of the association, Dr. Merle Clark, says the association is excited about the rollout and is working with the ministry to ensure the education of the public on the benefit of vaccines.
The phased rollout of the AstraZeneca COVID-19 vaccine in St. Lucia is set to begin soon. Frontline workers are at the top of the priority list for the vaccines. The St. Lucia Medical and Dental Association has indicated that St. Lucia's medical fraternity is looking forward to playing their part in stopping the spread of COVID-19. President of the SLMDA, Dr. Merle Clark, says the association is working with the ministry to educate the public a bit more on the vaccines.
We at the St. Lucia Medical and Dental Association are very excited about the rollout of the vaccine tomorrow. Vaccination, of course, will start with our high-risk frontline workers. Certainly, we are included in here, the high-risk physicians who are in direct contact with patients with COVID-19 and patients who may or may not be symptomatic. So we're excited about that. Vaccination is an important pillar in this fight against COVID-19. We want to encourage St. Lucians to desist from looking at and reading so many conspiracy theories, and we know they are out there. We urge you to get information from credible sources. We pledge to do more as it pertains to educating the general public with reference to the importance of vaccines.
She says she understands that there are conspiracy theories circulating everywhere. However, members of the public need to ensure that they carefully sift through the information being presented. Nurses in Antigua and Barbuda recently refused to take the vaccine due to a low efficacy rate. Dr. Clark says every physician in St. Lucia will be taking the vaccine.
We will be taking the vaccine. We want to tell St. Lucians that every physician is going to take this vaccine because we understand the science and we understand why those things are important, and we encourage you to do the same, not only to protect yourself, but to protect your family as well. So this rollout will be phased. Of course, you're looking at the higher risk people and then the rest of the population, and we are fully on board with that particular strategy. We have made recommendations as to how we think the rollout should happen with the use of other centers in the community to ensure that the pitfalls that other countries, the more industrialized countries, faced, that we don't run into those same problems. We want this to be a seamless, smooth process so we get as much of our population vaccinated as soon as possible, so we get to that elusive herd immunity that you hear about so much, which would require 75 to 80% of us to be vaccinated.
Questions have been raised as to whether life will be back to normal immediately after one is vaccinated. Dr. Clark says that is not necessarily the case.
As for the question of when the masks come off and when we need to stop social distancing, not yet. The reality is, even after you're vaccinated, you still need to do those things. The vaccine doesn't 100% prevent illness, but what it does prevent is serious illness, reduces the risk of transmission, prevents death, and that is what we are looking for. That is what we are fighting for. St. Lucians, we want to encourage you to take care of yourself generally. It's not just your physical health, your mental health. Laugh, read a book, watch TV, meditate, do whatever it takes. I think we tend to take everything too seriously.
Dr. Clark made a reference to the virtual sports meets organized by the St. Josephs Convent Secondary School and encouraged members of the public to find similar interesting yet safe means of relieving themselves from the mental and physical pressures brought on by COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzalez.
Thank you, Genevieve. Speaking of the St. Joseph's Convent, the week would not be complete if we didn't talk about the latest phenomenon taking over social media in St. Lucia and in the diaspora. We're talking about the St. Joseph's Convent Virtual Sports Competition 2021, of course. The event has brought a change from the usual hot but gloomy topics in the media, and one of the organizers is giving all the details of it in this report. The ladies of the all-girls Catholic secondary school, St. Joseph's Convent, have taken over social media by storm, in a good way, bringing some much-needed distraction from the current doom and gloom of COVID-19, politics and crime that have been dominating the airwaves. Through friendly rivalry and light-hearted banter, students current and past have found a way to host their annual sports competition with a twist, of course, through the SJC Virtual Sports Competition 2021. The colors yellow, green, blue, and red, otherwise known as St. Teresa, St. Maria Goretti, St. Anne, and Blessed Anne, are the talk of the town, and the race is on to get the most support for the different houses. The spontaneous idea has snowballed into a major event, which has seen not only past students from the diaspora, as well as non-SJC attendees endorse the different houses, but it has also garnered the support of local celebrities, including Darren Sammy and Boo Hinkson, as well as regional soca artists, including Kes and Patrice Roberts. But what is this competition all about, and how did it become the next big thing? One of the organizers of the event, Karen Tobia, explained.
That started off as an idea between three crazy people, Deborah Edwards, Sarah Lee Williams, and myself. But the people who don't know might not understand this, but when you go to the St. Joseph's Convent, you are in your house first and foremost. And your house becomes your life, because your entire life at school is reflected in your house and what your house does. And as from your behavior to your participation in anything at all, your house gets points, and at the end of the school year, all of these points go towards the best house for the year. So we are very, very, very competitive when it comes to our houses. And so you would have seen that we have taken over the virtual world with all of our colors. And I'm standing in green because Maria Goretti is the best house. I know Deborah will not believe me when I say that, because she's shouting her blessed hands all over the place, and Constance is promoting St. Anne's, and then we have St. Teresa's in the yellow.
And what of the details? Tobia said it goes further than sports.
This is happening on Thursday, the 18th of February, and we're starting at 8 a.m. in the morning with a assembly that is going to be virtual. And like we said, this is virtual, so everything is happening virtually. Assembly is going to be live on Facebook. And we have done it in such a way that all of the houses are actually part of our page on Facebook, which is the SJC Virtual Sports 2021. And to participate, you must be in your house. We have a 400-meter race, an 800-meter race, a 1,500-meter race, and then we have relays, and we have a match pass, and we have a marathon. So we have actual events, and they are happening virtually. There is a fundraising part for it, so people have been asking. When you go on the page actually has a place where we speak about the hot dog stand. So when you go into the hot dog stand, whatever you buy on the refreshment stand will go towards the school sanitizing fund. So we are encouraging all of our past pupils who are taking part in the sports to actually go and pledge and support. So this is not just about, we are mobilized, it's not just about having fun.
Tobia extended sincere gratitude to all those who gave the initiative its steam to push it to the level that it has reached.
I really want to express our thanks to all of the people who have jumped on board with this. I mean, we have the artists, the celebrities, so many people have just jumped on board with this. And what has been really, really good is to go on Facebook every day and see not just the alumni, but also members of their families posting their pictures in the house frames. So the support has been just wonderful, and we really want to say thank you to all of those people who have jumped on board. We actually have some business houses as well who have come on board just through this effort and say, we want to support you all in whatever efforts you all are making, and we will donate towards the school as well.
Yellow House St. Teresa was the winner of the 2022 SJC Sports Competition. Speaking of social media, a post written on the personal Facebook page of the Chief Medical Officer, Dr. Sharon Belmar-George, making reference to a question asked by President of the SLMDA, Dr. Merle Clark, during a PAHO meeting, has raised eyebrows, questions, and drawn the ire of many. Dr. Clark has come out to explain the situation and says the post by the CMO has been completely misconstrued.
A Facebook post by Chief Medical Officer Dr. Sharon Belmar-George has gone viral on various social media platforms and has sparked many debates in various social circles. The post, which makes reference to a question asked by the president of the St. Lucia Medical Association, Dr. Merle Clark, at a PAHO meeting, reads, quote, "So of all the questions to ask at the COVID-19 vaccine stakeholders consultation with PAHO, Dr. Merle Clark will ask, when is Carnival?" End quote. Many individuals have queried as to why such a question was asked and have even brought into question the priorities of the SLMDA president. Dr. Clark has responded to the critics and questions raised. She says the context within which the question was asked was legitimate and the post has been misconstrued by many.
The aim of the question during the stakeholders meeting, which was about vaccines, of course, and the introduction of the vaccine and the rollout, about which we're very excited to have received vaccines at this point, this very critical juncture, was to ask if, and we want the general public to know those things as well, that after you get your vaccine, the first dose, for example, and there's a 8 to 12 week gap between one dose and the other when your body is building its immunity to be able to fight off COVID more effectively or to reduce the risk of getting it or certainly the risk of serious disease, was do we still have to wear our masks and do we still have to physically distance? And the response to that is yes. So the Carnival question was, again, in keeping with that, is Carnival happening? Not just here, but anywhere. There was no definitive response to that because the reality is it very well may not happen. We have to get to a point where we have herd immunity.
Dr. Clark says with the advent of COVID-19, people have been stressed and mentally exhausted for quite a while. She says there is a need for individuals to be able to see the lighter side of situations.
We also want to encourage solutions. Again, we must have moments of levity at this time. We've been under stress for a year. With stress comes the release of a hormone called cortisol, which results in obesity and so many other negative things that we just want solutions, not to take everything so seriously. We want you to take care of your mental as well as your physical health. So be it yoga, exercise, reading, watching TV, whatever makes you happy. Laugh. These are things that take off a bit of the stress that we've been under during this pandemic. And that essentially was the context in which the question was asked.
She says, however, such questions are important as members of the public have been inquiring as to whether life can return to normal immediately after being vaccinated.
The reality is very many solutions are asking that question. Do we still have to wear our masks when we get the vaccine? Would we have to social distance? Is Carnival happening? The response to most of those questions, all those questions really is, yes, you still have to wear your mask. Yes, you still have to distance, physically distance, wash your hands and adhere to all those practices that we know are effective and unlikely. But I mean, the decision of Carnival certainly is not mine. We will certainly have a stake in what happens in that regard, but unlikely. We need to get to herd immunity before that.
She says the statement was simply misunderstood, as was the post of the CMO. Dr. Clark says the reasoning with which all questions were asked were to guide and further edify the public on the many questions that they have with reference to vaccination. Reporting for Hot 7 News, I am Genevieve Gonzalez.
The Ministry of Health is continuing with this transparency bid to the general public by announcing the approved rapid antigen tests and testing locations. Drug Inspector Astrid Mondesi gave the details in this video statement.
The Department of Health and Wellness informs the public that the antigen tests approved for use in St. Lucia at this time is as follows. The Fora COVID-19 antigen tests, the Abbott PanBio COVID-19 antigen tests, and the SD Bioscience Standard Q. The rapid antigen tests are approved for use under the following circumstances. As a pre-screening tool for symptomatic persons and contacts, for persons traveling to the United States. Private labs must request permission from the Department of Health and Wellness through the Chief Medical Officer to perform rapid antigen tests. The following laboratories are designated to carry out the polymerase chain reaction PCR tests. That is the Ezra Long Laboratory at the Owen King EU Hospital and the Forensic Science Laboratory. To perform antigen tests, the following labs: Laboratory Services and Consultations Limited, Microlab Inc., Global Clinical Laboratories, Descartes Laboratories, and Alpha and Omega Laboratory Services.
Mondesi continued on to state that all the positive results must be reported to the epidemiology unit in the Department of Health and Wellness on a daily basis.
Tests should be procured from manufacturers who work under a quality management system. Suppliers' recommended procedures must be strictly followed. The Department of Health and Wellness will be monitoring and evaluating test activities. The use of rapid tests which are not authorized by the Department of Health and Wellness is discouraged. Importation and queries of rapid antigen tests will be addressed by the Department of Health and Wellness for the Office of the Drug Inspector.
That was Drug Inspector Astrid Mondesi. You're watching the Hot 7 TV Nightly News. Stay with us, we have more after this break.